Why you sleep all day? Why you sleep all day? And then up all night? You must stay up. You must stay up. Oh, big yawn. Oh, Penelope. You're so cute. Sonja.
Yes.
I thought you were supposed to be recording for me today.
I'm almost over there. I'll give her back in a minute.
No, she should be recording this. Missed it. All the good stuff. I'm recording now. Say that again.
Every day is Sonja Day in oncology.
We love you. We love Sonja. I love you too, Red. Want a hug?
She's like,
Red, you want a big hug?
no, I'll pass.
You make me feel sad. I'm gonna go cry. Good morning, everybody. I wanted to introduce Penelope officially. She is the new addition to our family. She's a little wiggle worm. She is about 10 weeks old right now, and she comes to work every day with me. You've been such a good buddy. And we like to give Matilda a little bit of alone time with the nanny so she can rest. So I'm just waiting to put her in the back of the car in her crate where she'll be nice and safe. And we're off to work for another busy day of fighting cancer. And we're off, so say goodbye. Say, hi everybody, I'm keeping Mom up all night. She's sleep deprived now, but she's so cute. And how do you not love this dog? How do you not love her? Ready to go to work? Ready for the commute? You ready for a nap? Okay, say goodbye. Oh, you're so cute. I love you. I love you. Penelope. Say bye-bye. Oh my goodness, so late today, so much traffic, almost ran out of gas, and I got a busy day. So let's see if Penelope can pee quickly, because we're in a rush. Okay, let's go. Hi little girl, you ready? Penelope! Who's a good girl? You ready? Okay, let's get you out. A little bit late, but we won't talk about that. We're gonna round, but most importantly, look who's around.
Hey, Penelope.
Penelope.
Who's that?
She's the new official mascot of Team Onk. She'll be giving chemo by the end of the week. Just kidding. All right, so Blackie has blood work already because you guys rock.
Blackie is a beautiful flower today.
Cool. And then Willa's here. I saw her in her cage, wagging her tail. What's the Willa girl do for? Hey, Christine. All right.
Her last cycle. Yep.
I know.
Next week is her last.
No, I mean that's great, but I love her and miss her. Maybe Dad can just drop her off once a week. Perfect. And we can just love her. And then Tanner's coming. Just want to make sure that you peep. There's no way to get that blood work imported. You have to call Antec.
Wants the T-Rex.
Yeah, we can.
Penelope versus the dinosaur. That's Elisa. She's
I'm gonna vote for the dino. You still want this? Kind of boring. Shouldn't we stop?
stealing Dr. E's phone. And this is our kennel where our patients, like Willa, spend most of their time. It's nice and large and air conditioned, so they're comfortable while they're waiting for treatment or after treatment, when they're waiting to go home. All right, come here, Miss Perfect. Come on. This is Willa. I'm sure you guys have seen her videos before. She is a corgi mix who is probably the most adorable thing on the planet. Come on, jump down. Oh, those legs. All right, come on, hold on. Good girl. Okay. And since Willa's the first one here today, she gets the room with the view. As you can see here, she has plenty of blankets, so she's nice and comfortable while she's waiting. And look at those little corgi legs. They're so perfect. Okay. All right, we are...
He's like a puppy. The dog is so cute. Willa! Willa, you want to say hi? She's really obnoxious.
Julie's like, oh my god. Oh
Hi,
my
Willa.
God.
Penelope is so fascinated.
Sure, let me at him.
And Willa
You're so cute.
Willa don't care. Willa cares about people.
Look, oh, yeah.
Willa just wants to say hi to everyone
Look
in
at her.
the
She's not even.
room.
She's just sitting there.
She's just...
Wait, you're gonna come say hi? I warn you. I warn you. I warn you. There's a puppy that's gonna pounce. It's a puppy. It's gonna pounce.
I know.
Wanna say hi, Penelope? This is a dog. Dog.
Doggo.
One time
And
Willa's
Pepper.
gonna be like, oh, I don't like you.
But you look.
She's like,
Okay, I'm gonna go over to Suzanne.
She...
Alright, let me look at Willa. Let me put the little pumpkin away. Come here.
Okay, I'm out. Willa's my money. I'm gonna do her right away before my 11.
Want your ball? She goes, no, I've trained my mom to carry it.
Walking better too.
He does look like he is.
We have the other thing with us in case you.
Okay.
Say hi. Say hi. Say hi. Say hi.
What do you mind hanging out with Tanner? Right, Tanner? Yeah. Hi, buddy. You're such a lovely boy. All right.
Yeah, I don't think you're gonna. I mean, you want the.
He looks really good today, so
Yeah.
I
He
don't
looks-
think so.
Most of us in oncology are fear-free certified. We have this awesome fear-free kit here. We have dog treats, pretzels, peanut butter, Feel-Away, which is a synthetic cat hormone to make them feel more comfortable. We also have the same thing for dogs, which is called Adapto. And what I'm going to do is, Tanner doesn't quite want to leave mom and dad, or actually their grandma and grandpa. So I have dog treats that I dropped. See if I can lure him. Tanner, give me here.
We'll just throw it at you. I hope you don't mind.
You don't want our cookies. Okay, fine.
Come on. He says we can go this way. Look. Here, how's this?
All right, so
There you go.
hi
We
Tanner.
made it.
He's coming to see Dr. E for the first
This way.
time in a little bit.
This way.
Everyone's excited to see him.
Oh, where's his harness?
He actually wasn't falling over.
Until he got here.
He's just
under you.
he's falling over with excitement
Oh, come here. I know, it's so exciting. It's so exciting.
because we haven't seen him in ages.
Missed you.
He's doing great. He's got diarrhea on and off, but otherwise,
Okay.
And they're using the metronidazole and the clay and everything, the Fortiflora. So,
Okay.
Tanner! What's up, handsome?
He's
Still in remission?
He's got lots of energy. He's
better be.
outside more. He's playing around all the time. He's
Wore the wrong colored pants for you.
And this is the terrible exam that Dr. Edinger has to perform on all of our patients
Why is it terrible?
because you have to love on them.
Oh,
It's
yeah.
awful.
I was like, he doesn't look that miserable.
Our poor patients
called
have
sarcasm.
to have
Okay.
they
I was like, what did I do wrong?
they get their lymph nodes felt just to make sure they aren't feeling plump or they're staying consistent in size. And Suzanne is holding Tanner's mouth closed because it's easier for Dr. Edinger to hear the heart.
Heart and lungs sound good, mister.
And then she gives belly rubs.
And I get belly rubs. I'm actually feeling for
That's
stuff.
but belly rubs are part of the exam. Every patient gets belly rubs except our kitty patients who don't quite appreciate belly rubs.
Your lymph nodes feel fabulous. So Tanner had lymphoma and he finished chemo 2 months ago. At his last appointment, we did a pretty comprehensive check with lots of blood work and urine and a belly ultrasound, even aspirated a node. But if the lymph nodes feel good, I usually use a test called the lymphoma blood test, and that and an LDH, which are can help pick up relapse earlier than we can pick it up on exam. And that's it for today. Yeah, what do you think? All right, let's get some blood. Here's Kitty. So Blackie's gonna get a CT, hopefully to show that his nasal adenocarcinoma is still in remission. My super fantastic team has got him anesthetized. We do some scans, wake him up and send him home. Okay. I'm going back to my regular scheduled program. I have to get Tanner out. All right, let's do some aspirates on Mr. Blackie. And lay outside, frosted side up. That help his pressures? We'll see. Nothing. I'm gonna try again. They're very little, which is good. I'm like, good kitty, but he's under anesthesia. Yay. Yay. Stuff.
Can you grab me small Penelope?
Do it again. These are so little, I would never get these if he was awake. They're teeny. Teeny lymph nodes. We like teeny. Oh, that was a good one too. That was a good one. Ooh, chunky. All right, so those are the left. Let me come around and do the right. And then I gotta pee. Yes, I have to pee. I drink a lot of coffee. I got a puppy, people. I drink a lot of everything. That sounds really, really bad. I always say you guys have no idea what's in my sippy cup.
Nope.
Nope.
Mmm.
Weren't we just talking about happy hour?
Yep.
Well,
Turn off.
What? I got missed out.
No, we wanna have mojitos.
Oh, yes.
Clock out. We'll go sit outside on the grass and have mojitos. Don't you think? More slides, girl. Get it one more time, and then we're out of here. So uncommonly, but sometimes nasal cancers will spread to the lymph nodes in the neck. So that's what we're checking with his cytology. And I am a happy girl. All right, I'll label the right. You can label the left. We are out of here. Bye-bye.
Bye-bye.
Bye-bye. No, I said bye-bye. All right, so Blackie's done with his CT scan, and he's waking up, sort of. I mean, he's sleepy. He's under a bear hugger, which is blowing warm air to keep him nice and warm. What was his last temperature? So dogs and cats and people, we get cold under anesthesia, so we do a good job trying to keep them warm when they're under, and then we keep them here till they're awake and at least 100 degrees, which is pretty normal for a kitty. All right, Blackie, you enjoy your warmth. I might crawl underneath you because our hospital is so cold. Hi there. So now I'm going to take a preliminary view of Blackie's CT scan now that the images are transferring. Everything gets sent to our board certified radiologist, but I always like to take a look just to make sure everything looks okay before Blackie goes home. So as a refresher, that's the cat with a nasal tumor that got radiation almost a year ago. And we're also, so we scanned his nose and his chest. The chest is to make sure there's no spread. So I just pulled the images up here. Let's see, we'll go to the front of the lungs. And again, the radiologist will look at everything, but I just like to do a cursory view. The right window. And so I'm going from the tip of the lungs towards the neck, back through the lungs, making sure there's no nodules or metastasis. So in this one, I really like to look at this view. Starting to see the liver. So this is the liver down here. This is all lungs there. And again, this is a very quick cursory view, but again, I like to make sure before I send them home that hopefully we won't be surprised with any bad news. So that looks good there. Again, the cool thing about this is now I can move this bar here. You can see we're going from one side of the cat to the other. And we can also go top to bottom by moving this. And we're going to the top of his lungs by his back, going down. So we really get a very good view, and that's why CT is more sensitive than chest x-rays to find nodules. So definitely prefer test, but requires anesthesia and is definitely more expensive. All right, now let's look at the nose. See, there's still a mass effect here on the right, but we'll have to go back and compare that to previous treatments. So again, most of the nose should be air. So I'm concerned about, where's my pointer? This area up here. But again, we have to compare this to his previous CT. And then here, we're going to follow his nasal passage back. Again, this is the area that I'm concerned with. Again, we'll need to compare that to his previous treatment. Sometimes with radiation it'll just be stable, or that will just be scar tissue. So we'd like to do serial CT so we can compare them and see is the mass getting bigger or smaller. He is far enough out, he's a year out, that we actually could repeat radiation if the owner wanted to. I'll have to anxiously wait for the radiologist report, and I'm going to go compare. So here I've pulled up a January CT scan, and there still is disease on the right side, but we'll need to do a side-by-side comparison once the images get transferred. They're not over to this software, to this computer system yet. And I can compare side by side and see if we're stable or if the mass is getting bigger, which would be suggestive that the tumor is regrowing, but hopefully not. So we'll just have to be patient until my images get transferred and see from there. Penelope, how's your day at work?
It's crappy. It's very crappy.
Oh, but bum. Oh, you better sleep tonight.
No.
Do you like Chloe?
Yes.
Do you want to go home with her for 3 months to your potty train?
Yes.
Okay, good. Just bring her
Wear
back.
a diaper.
God, can you imagine? Oh, you know you're going to be in the vlog, right?
Oh gosh.
All right, you little crazy dog, Luigi.
You can't decide which leg to move up. They run this test and basically just make sure that her kidneys are functioning.
Sonja, am I allowed to put you in the video? Todd, you're broken?
Sure.
Do you have anything to say about today?
Today was fun.
Okay, good. I love you. Okay. You want to say goodbye? I forgot Carrie on camera. I'm going to have to cut it though. All right, say bye. How was your day? Do you love your job? Yeah. Thanks for all your hard work. Okay, bye-bye now. Drive home safely. All right, we're waiting for the car to cool down. It was a busy day, but we did great. And we like having little Penelope with us. It makes everybody happy at work. Yeah, what do you think? Did you like your day? Yeah. Anyway, thanks for joining us. Penelope says we love you. And we're on our way home, see the boys and Ms. Matilda, and have some playtime. And then get up, repeat again tomorrow. See how many times you have me up today. All right, bye everyone.